it's really important to be vocalized before going into the surgery so the family can be really have an informed decision. The bleeding was a big factor that we were thinking about, because with Will's condition, some of the boys tend to bleed a lot, substantially, and that was an issue for Will. Managed well, but it was a concern that the hardware wouldn't take because of his soft bones. That I think is an issue for many with neuromuscular issues.
Talking about complications, the two things I fear the most are prolonged pulmonary problems afterwards. So if you get into a cycle of difficulty supporting one's respiration without ventilation and aspiration and prolonged pneumonia, then you spend a lot more time in the hospital. Lots of other things go downhill. So postoperative pneumonia or respiratory complications, I think, are right up there on the high list of things that people should be worried about. Infection of the operation is still a common thing in neuromuscular or complex scoliosis. Obviously, there are all sorts of things that we do to make it as unlikely as possible, but in general, the sicker the patient is going into this, the more likely it is to happen, and the sicker the postoperative course. So even though the patient may have been not so bad going in, if there's a prolonged, complicated postoperative course, if the patient has bowel perforation or some other surprise thing, or intractable seizures, or ends up being ventilated for a long period of time, the longer you are in the intensive care unit with more things going on, the more likely you are to show up later or sooner with an infection. And deep wound infection after extensive spinal surgery is our worst situation, because it then requires both a prolonged hospitalization for antibiotics, but it also requires repetitive visits to the operating room to periodically wash out the infection and gradually try to get it to close. And it's a thoroughly unsatisfying experience for the patient, for the family, and for the healthcare system, because it's a tremendous use of resources. So that's what we fear the most in complications, and I think that in warning the families about what can go on, I think that's up in the long list of, or high in the list of complications that we warn people about. And we warn people about complications not just to kind of cover our tracks or to be legal about it, but to truly warn them that this may happen to them, and that we're all prepared for it.
And in addition to those, I would just add that we kind of think about complications in the space of any exacerbation of an existing chronic condition. So you're sort of coming in with epilepsy, but the epilepsy is worse after the surgery, or there's an exacerbation of seizures. Same with constipation or reflux or aspiration, all the respiratory things that Dr. Emans had mentioned. Even things with the urinary system, urinary retention could get worse after surgery. Sort of thinking about all those things. And we also think a little bit about skin complications as well, even in addition to the surgical incision site. But just positioning in the bed, and ankles and the buttocks and everything else, that if the patients aren't adequately cared for from the skin setting and turned and all these other things, that you can develop a pressure ulcer and those kind of things. So the challenge is the rates of truly quantifying the risk of those things is very tricky. There's so much uncertainty in that, but I think that articulating those things ahead of the surgery to have the families prepared that they could happen is important.
Yeah, the longer one lingers in the hospital, and the farther you are away from your usual home care setting, the more potential things that can go wrong. So, just talking about the extremities, if you spend a long time in the hospital, then it'll be a long time before you get to use your prone stander at home. Exactly. And your extremities will become more osteopenic than they were otherwise, and you're more at risk for fragility, fracture. Your muscle mass goes down. one of the biggest bugaboos postoperatively is just enteral nutrition. Getting people back on their normal feeds takes a remarkably long time. The combination of changing their body shape plus introducing other medicines for pain or other antibiotics for their pneumonia messes up the normal enteral function, and that keeps you in the hospital longer. So they're a carefully balanced entity going into all this, and the more we unbalance one part, the more other things are affected.
That's exactly right. And to your point of staying in the hospital longer, I mean, every day that you're in is another day where the inpatient staff is going to be administering all your medications, all your equipment and everything. And the chance of some type of adverse event or harm leading to that administration is always going to be there. So no complications, short length of stay, get back home.